The burden of chronic diseases is increasing rapidly around the world, and that's one of the main issues that's being addressed at the International Council of Nurses Congress being held here in Singapore.
And for more, we're joined by Senior Minister of State for Health, Amy Khor, and Chief Nursing Officer of the World Health Organization, Elizabeth Ero, who's here for the Congress. Ladies, thanks very much for joining us this evening.
Thank you.
SMS, let's start with you. So countries around the world, they're increasingly grappling with issues like aging population, the burden of chronic disease. Singapore, no different as well. In fact, to cite a recent report, we're finding that people here are living longer, but are spending more years in poor health. How is nursing helping to alleviate this problem?
Well, first of all, I think to tackle this challenge, we need to move upstream from treating diseases to promoting health, so that Singaporeans can continue to enjoy a good quality of life for longer. And nurses play a very vital role in delivering preventive health services in the community, so that we can go beyond healthcare to health. And in fact, for nurses in Singapore, they play a very important role in supporting MOH efforts to anchor care in the community, so that Singaporeans can receive care closer to their homes. And in fact, for this, to support preventive health and anchor care in the community, we actually set up community nursing teams in 2017 across the island. And we are going to increase the areas that will be covered by the community nursing teams from 18 to 29 across Singapore. And now we have about 210 community nurses from our 3 healthcare clusters providing care to our seniors with different needs across various care settings. And they are actually complementing the work of our other community care providers to improve the delivery of care.
The importance of the work they do just simply cannot be understated. Elizabeth, let's bring you in on the conversation on this topic. What kind of skill sets do nurses need to develop, especially with healthcare demands changing in this way?
I think the nursing skills can be quite broad. It's about what are the health issues that you're trying to address. I think it's critical to understand what the country context is in terms of the status or the burden of disease. And I think if you look at that and take the focus around the upskilling or the optimizing of the nursing profession to ensure that they've got those specific skills, at the same time, kind of in an advanced training, capture those skill sets needed to address those issues, whether it be about rehabilitative care, whether it be about the NCD-specific care, whether it's about the aged care. So those components, I think, require some specifications. But I think generally, what you want to have is a nursing workforce that can be, that is a journalist expert or a journalist specialist. So they come in, but still able to deliver the type of care that's needed that keeps people in the community, in their homes. And I think that's the focus around keeping people healthy. It's about also making sure that they have the skill sets that is patient-centered, that it is about the patients that's the focus. So what does that mean? What kind of skill sets does that take to do that? So it's about respectful care. It's about compassionate care. It's about communication. It's about, then you come into the specificities of the skill sets that's required to that specific condition. So I think, that's the type of workforce you want to optimize to address those cases. I think, the WHO definitely has a focus around primary health care. And I think nurses have a very key role in actually being engaged in that environment. And as you just heard the Minister say, it's about focusing on health.
Just very quickly, another really exciting area is technology, and it's changing the healthcare scene. Do you think the nursing profession is harnessing technology enough at the moment? I
think there's definitely opportunity there to expand the competencies around that. This is about, where the governments want to take this, enable this type of care within the population. Very, very critical in terms of what can be done using those modern technologies. Again, that's a specific skill set then that would be required to uptake, to make sure that we're using the technology in the most efficient manner.
What's Singapore's perspective on this?
Yeah, So actually for us, we're working very closely with the public general hospitals to adopt smart solutions to improve productivity as well as to reduce the nurses' administrative load so that they can spend more time in direct patient care. So some areas that we are already working at would be on inventory management, care documentation, materials delivery, patient transfer, and management of care supplies, for instance. And in fact, we have already put in place more than 800 bed transporters, for instance, across our public hospitals to actually reduce the manual load handled by the nurses and other healthcare staff. And we are also looking at smart robotics to deliver and retrieve essential items to and from the point of use to save nurses' time. And in fact, we actually have a smart nursing ward program by the Center for Healthcare Assistive and Robotics Technology, where they are actually looking at introducing innovative and solutions to improve productivity in various areas, as well as helping the hospitals to set up and scale up smart nursing wards, leveraging on technology as well as process redesign.
Right. I think the crux is really putting the nursing back into nursing, putting the people at the front and center of providing care. Thanks very much, SMS, for coming into our studio. Elizabeth, thanks very much as well. We've been speaking there with Senior Minister of State for Health, Amy Khor, and Chief Nursing Officer of the World Health Organization, Elizabeth Ero.